Yes, yes.
Okay, so now we move on to do definition of terms. Yes, you should know that I'm recording this, okay? I am recording, okay? So definitions and etiology. Definition and etiology. So we are saying what we are looking at Tetanus neonatorum. We are saying this is an infection that occurs in the newborn neonate. This is an infection that happens in a newborn neonate. Let me mute your microphone. Let me mute your microphone. Where is it? Wait. Okay. All right, so we are moving on, okay? So let me, Moika, say something.
Sir, how are you?
I'm okay. So for you, your microphone, I'll be able to have a conversation with you as I'm presenting. Everyone have put their microphone on mute, okay?
All right, sir.
So whenever I
Okay.
say, are we together, it is from you that I want to be getting feedback. I'm doing a lot of
All
things
right, sir.
go, so that's the thing you need to know. So definition and etiology, okay?
Okay.
So
Yes,
this
sir.
infection occurring in the newborn neonates. So tetanus is an acute spastic paralytic illness. Positive organism is Clostridium tetani, okay, and it produces neurotoxins, meaning it produces toxins that are toxic to the nerves. Okay, so
Yes, sir.
in knowing tetanospasmin, which causes spastic paralysis. Okay, so it produces neurotoxins, that is tetanospasmin, which causes spastic paralysis. Okay.
Okay.
All right.
Yes, sir.
So we move on to the next slide.
Okay.
All right. So Clostridium tetani is a slender, motile, gram-positive anilobe spore-forming bacillus. Okay. So spores viable for years in soils and animal feces. So tetanus spores survive boiling but not autoclaving. Tetanus is able to live in spore form. That's what we are saying. You remember in your microbiology when you say in a spore form, a more dormant form. You get the name? So vegetative cells are killed by antibiotic health and standard disinfectants. So what we are saying here is that tetanus spores can survive even to boiling, but not when you are autoclaving. Autoclaving is able to kill the tetanus spores. So,
Okay. So
we move on to, afterwards you ask questions.
right.
Yes, yes.
Okay, sir.
So etiology, so tetanus toxin is second most poisonous substance known and surpassed only by botulinum toxin. Okay, So neurotoxin, remember that one? It produces some neurotoxin. So epidemiology of the disease. Clostridium tetani is found worldwide and occurs in infants whose mother has not been vaccinated during pregnancy. Remember, in pharmacology, you had an assignment on immunization schedule for women of childbearing, so that they are fully protected.
Yes.
They are fully protected, and also so that they do not put their babies in danger. So Clostridium tetani is found worldwide and occurs in infants whose mother has not been vaccinated. So mother should receive at least 2 injections during first pregnancy, and often mother should have delivered at home and used unsterile laser blade for cutting cord and unsterile cloth for the umbilicus. So, you know, when the baby is born, there is some clothes, sometimes they tie to the umbilicus so that it does not continue bleeding. So we are saying if it is not sterile, it's not clean, it may have the tetanus bacteria. Okay, so mothers should receive at least 2 injections during the first pregnancy. Okay, so we know it's 5 injections for a woman to be fully protected. Okay?
Yes.
So, moving on to the next slides. So occasionally, there is history of applying cow dung to the umbilicus. So occasionally, the disease has continued to exist because of certain practices where they apply cow dung to the umbilicus. Vovo, how are you? Vovo. You are okay?
Sir, it's cutting.
Okay.
Like the audio is starting to be. Yes, I'm fine, sir.
Okay, thank you. So I'm continuing with the lesson. So clinical disease does not confer immunity. It does not mean when someone has suffered from the disease, they need to have immunity. No, it does not mean that. Okay, so occasionally there is history of applying cow dung to the umbilicus, and clinical disease does not confer immunity. So we look at the pathogenesis. We are looking at the pathogenesis. So tetanus occurs after spores which have been introduced into the tissue, which is poorly oxygenated. Okay, oxygenated, that is, multiply and produce tetanus toxin. So when you're exposed, remember, to the cow dung and that cloth, you are inoculating the bacteria to the skin. You're introducing the bacteria to the skin. When you have introduced the bacteria to the skin, okay, so those that are memory ones, you come in, you don't make noise. All right, so they're saying when you inoculate the bacteria on the umbilicus to this unit, okay, the bacteria at that site, it starts to multiply. Okay, it starts to multiply. So tetanus occurs after the spores which have been introduced into tissue, that is, which are poorly oxygenated, germinate, multiply, and produce tetanus toxins. Now we are going to go to plasmin, which is produced as the vegetative cell dies. When the cell dies, it produces tetanoplasmin. The toxins may enter the central nervous system along the peripheral motor nerves, or may be blood-borne to nervous tissue. Okay, so we're saying when the bacteria dies, that is the vegetative, it will produce tetanoplasmin. Okay? Okay.
You guys are making
So we are moving on with the. Okay, we are moving on. So now, tetanoplasmin binds to the ganglioside membranes of nerves, synapses, blocking release of the inhibitory transfer or transmission or transmitter from the nerve endings. So you're saying the tetanoplasmin is going to bind to the ganglion cells, that is the ganglion membranes of the nerves, synapses, okay? Blocking the release of the inhibitory transmitter from the nerve endings. So when this happens, it is going to cause generalized tonic spasticity, okay? Usually superimposed with intermittent tonic convulsion. So this is going to affect the feedback mechanism, so the patient may not have control of their muscles. So they are going to have tonic spasticity, and it is superimposed with intermittent tonic convulsions. So once fixed toxins cannot be neutralized, we can see other clinical features, okay? So tetanus will be localized or generalized. The incubation period is 2 to 14 days, and however, may be long as severe months or after an injury. Okay, so now, what are the clinical manifestations of generalized tetanus? So patient may have trismus or masseter.
Son, if you've gone.
Okay, masseter muscle spasms or lockjaw. And this is found in 50% of patients. Also presents with restlessness and irritability. So patients may have restlessness and become highly irritable. So this is followed by stiffness and neck spasms. So there is what we call the sarcoidoneous smile, the smile that we see in tetanus, that can also be seen. Okay?
Yes.
Okay, okay. So that can also be seen. So we call that rhesus sardonicus, okay? That is the sardonicus smile that you see. No, you're smiling, but it's like you're just more like exposing your teeth, okay? You're smiling, but
Yes.
it's not necessarily a good smile. So rhesus from intractable comes from intractable and echo. Okay? So paralysis is spread to abdomen, lumbar, and thigh muscles. Okay, the paralysis is going to spread to affect the abdomen, the lumbar part, and the thigh muscles. This they may then cause, okay, an act posture that is called obstetanus. Okay, this causes more like an arc posture. Okay, you know, an arc, more as arc posture. That is called obstetanus. So the obstetonic posture is due to unrelenting total contraction of opposing muscles. Okay, that's why we have this, because of opposing muscle contraction. Patient is going to have obstetanus kind of posture. Okay. All right, so let me move on to another slide. So other clinical manifestations include there can be laryngeal and respiratory muscle spasm that can lead to airway obstructions and asphyxiation. So meaning our patient is going to have breathing problem. So, when I'm done with the lessons, I'll allow you to pose questions, okay? So don't worry, I'll allow you to pose questions when I'm done with the presentation. So tetanus toxin does not affect sensory nerves or cortical functions, but thus patient may remain conscious. Therefore, patient is in severe pain and scared of the next spasm. So patient may continuously have muscle spasms that are very, very, very painful. Okay. So it does not affect the central nervous system. Patient will remain awake. Okay. So seizures are characterized by sudden severe tonic contraction of the muscles with first clenching, okay, clenching, flexion, and abduction of arms, and hyperextension of the legs. So seizures are initially for a few seconds to a few minutes, but however, with treatment, seizures become progressively sustained and they become quite exhausting. You know, when the patient is having seizure, it uses a lot of energy. Uses a
Me, I
lot
can't get anything, guys. See, I can see him. I can see that he's teaching something. Yeah, I can see the notes, but I cannot get what he's explaining.
Okay, so I'm explaining a bit by bit. You don't need to be
I
in a
can see him, but I cannot get what he's saying. I can see the notes, but can't get what he's saying. And I really need to get that.
Yes, Vovo. I'm saying you need to just try to move a little bit. Can be some network challenges that you're having here. Okay.
Yeah.
All right. So I continue now. Okay. So we are continuing. So other things that can be seen are any disturbances by sight or sound or touch triggers a tetanic spasms. So with all this, the nerves becomes excited. The patient may have tetanic spasms, may have some spasms, muscle twitching, may have those. Dysuria and the urinary retention may occur from bladder sphincter spasms. The patient may have that. Okay. So forced defecation may occur as the patient is convulsing. They may have first post defecation, right? So
Okay.
patient may poop after convulsion. That has been seen. Okay. Then progress of tetanic paralysis is more severe in the first week, but may stabilize in the second week. Okay.
Yes.
The second week and subsides slowly over 4 weeks, meaning as the disease progresses, the spasms may stabilize. Okay. So any disturbances by sight, sound, or touch, we said, may trigger a tetanic spasms. All right. So now, where there is some infection, we are expecting temperature also to rise. So, yes, Yvonne. Yes, Yvonne, you raised your hand. Okay. All right. So she just raised the hand for fun. Okay. So now, fever may be as high as 40 degrees Celsius due to high metabolic rate. Okay, that is caused by spasms. Okay, and autonomic effects occur, which may include tachycardia. Patient may have arrhythmia. They can also be libre, hypertension, and cutaneous vaso. So those are things we distinct. All right. So the notes I'm going to say, but I'm sure I've given you the notes already. All right. So now, what are the other clinical manifestations? Typically, manifest within 3 to 4 days of birth as progressive difficulty feeding, sucking, and swallowing. Because of the muscle spasms, muscle stiffness, patients find it very difficult to feed. So they can be associated hunger and crying. Because of the pain the child is passing through, they may have hunger and they may cry a lot. Okay? So paralysis or diminished movement, stiffness to touch and spasm with or without obstructiveness characteristics may characterize the disease. The umbilical stump may hold dirt
Okay.
or the same dung that was used as a sign of what was introduced. Okay, or so it means you have to clean the umbilical stump. Okay.
Okay. Yes.
So spasms may occur in muscles adjacent to the wound site. So muscles that are adjacent to the wound sites, you may see some spasms. And it may precede generalized tetanus. So then we can also now maybe have cephalic tetanus. It is localized tetanus of the head, that is the one, and it involves bulbar musculature. At this level, we are saying now the central nervous system is affected. So it occurs due to wounds or foreign bodies in the head, nostrils, or face that can occur if someone has chronic otitis media.
Yeah.
So cephalic tetanus is characterized by retracted eyelids, the deviated gaze, trismus, also going to see rhesus sardonicus, and paralysis of tongue and labial muscles. So you see that. So how best can you diagnose this? Regular lab studies, usually normal white blood cells increased secondary bacterial infection. And when you do a CSF normal, it would be normal except for increased pressure. Okay, pressure in the EEG, but the EEG is normal. Except the increased pressure, but the EEG is going to be normal. So tetany,
Yes.
not always visible on a gram stain. Okay, but in 1/3 it can be visible. So diagnosis mostly may be based on some clinical findings of presenting signs and symptoms. So the clinical signs and symptoms here may mean that you have to do some differential diagnosis. Okay, I'm seeing some noise from Jeff Kapisha. Let's reduce the volume. Let's reduce your mic, Jeff Kapisha.
Okay.
So, some differential diagnosis because of the clinical presentation of tetanus, you may mistake it to other conditions like rabies or hypocalcemia. So, trismus of the parapharyngeal, okay, differential diagnosis. Okay, there's a lot of noise here. Okay, so differential diagnosis for someone is the parapharyngeal abscess, and then rabies, hydrophobia, that is those are the ones that we see in rabies, dysphagia, predominantly chronic seizures. So we're able to see all these things, and then can we say, is it tetanus and the likes? So differential diagnosis, we need to take proper history so that we are able to rule out this. And then in hypocalcemia, spasms and scalpel, pedo, and laryngeal. Okay, but trismus is absent. So these are instances where the condition may seem, these are instances where the condition, you may not be sure as to whether this is it tetanus, is it rabies or hypocalcemia. So you need to
Yes.
and get proper history. Hello, Kasibonki, you're making noise. Do you think? Yeah? Okay, so we move on. We move on. Treatment. So we move on to treatment. So how are we going to treat Clostridium tetani? So you have to clean and debride the wound to remove the environmental You have to debride the wound in order to remove the environment that is conducive for anaerobic multiplication. That is, you have to clean the umbilicus, okay? So that you leave an environment where at least there's good oxygen circulation, because the procedure lives in anaerobic condition. It likes to live, or it lives where there is no oxygen. So we clean the home so that oxygen pass. Hence, it will not have the carbon dioxide that it needs. You can administer human tetanus immune globulin that can be 500 to 6,000 units. And you can give antibiotics to eradicate Clostridium tetani, that is penicillin. Penicillin G can be given, that is in those doses that we have been stated there in 2 divided doses. Okay, so that is the way you give. And then other drugs that can be given include metronidazole. Okay, I've quoted the dosage for you there. So twice, the dose can be twice daily, or at least 7 to 10 days. You can give that. In allergic patients, you can give the erythromycin. That is if the patient cannot tolerate metronidazole. So you can give absorbed tetanus toxoid. It only becomes effective in about 10 days. So after 10 days, you cannot give tetanus toxoid. Okay. All right. So. All right. So I'm sorry. I was just trying to admit some people. Okay.
Okay, sir.
All right. So now, with that, we continue. So, the patient has to be encouraged to relax because of the muscle spasms that we may be having. So, the drugs that can help in that is diazepam, provides both as muscle relaxant and also for seizure control. The dose can be 0.1 to 0.2 milligrams. Okay, so
Yeah.
sorry. How to enter. Okay, so chlorpromazine can also be given, magnesium sulfate can also be given because of metabolic acidosis that the patient may have. So you can give magnesium sulfate. So
Okay.
yeah, you have to know that when you're giving diazepam, it is titrated to control that is tetanic after which it is the it is sustained for 2 to 6 weeks before tapering it off to avoid control. Because diazepam is a drug of addiction. So the dose has to be tapered. With. All right. So premium is broken and his best survival rate can also be given. So other things that can be done include putting up an endotracheal intubation. Remember, the patient may have some paralysis within the respiratory tract. So it's important that you put the endotracheal tube, okay? Because of the upper respiratory paralysis that the patient may have. So you have to monitor vital signs, pulse, respiration, and the likes in order to rule out cyanosis and other things that the patient is prone to. You can maintain hydration and you have to give enough fluids. Wow, the complications. So, hello? Please, Favor, you're making noise. Favor, you're making noise. All right, so complications of this. The patient may have aspiration of secretions because of the upper respiratory paralysis that they have, and they may have aspiration pneumonia. So aspiration of secretions leading to aspiration pneumonia, and they can have hazards of mechanical ventilation. Okay, so hazards of mechanical ventilation, patient may be on a ventilator. to help them with the breathing, so may have hazards to do with that. So seizures may result into restoration of mouth or tongue, okay, hematomas and rhabdomyolysis with myoglobinemia and renal failure or fracture of long bones. So these may happen to the patients. Okay, so
Let me sit down.
Okay, so other complications may include venous thrombosis, pulmonary embolism, gastric ulceration, possibly with hemorrhage, iatrogenic apnea, cardiac arrhythmia. Okay, so just ensure you put your microphone on mute, please, so that we do something formally and nicely. So in infants, cerebral palsy and mental retardation may also be seen, okay? So in infants, cerebral palsy may be one of those complications that may occur. Mental retardation, iatrogenic apnea, okay, that may be due to the relaxation of cardiac arrhythmia, so such may be seen. So now, prognosis, mostly recovery occurs due to regeneration of synapses within the spinal cord and restoration of muscles, mostly very young and very old. So now, this is the session for you to ask questions. I'll go back with my slides so that we can be moving together. All right, so I'm allowing you to ask questions. Don't talk at at one go. You have to just raise your hand. Okay, but I'm unmuting all of you. So just raise your hand. There's a provision for raising your hand. Hello, your microphones are on, so don't just raise your hand, then I'll be able to see you. You just raise your hand. Okay, so were you able to follow the lesson for today? You don't make noise. Dali Sotiri. Read me. It's a question for you to ask questions. Natasha Nkole.
Yes, sir.
Any question? Yes. Any questions? Any questions? Okay. Ellen, making that of any question. Steve Kamanga. Please remember the lessons you are learning now, they will be repeated in class. So I'm encouraging you to ask questions or forever audience.
Sir, I didn't get the predisposing factors.
Okay, so when the predisposing factor are that when a mother is not fully immunized, it's going to predispose the baby to getting the infection. Okay, if you use sterile equipment, you predispose the baby to getting the infection. So almost all deliveries from home predispose the mother to the infection. Have I answered your question? Are you satisfied? Hello. When question? Hello, when question? All right. So I should take it you manage to understand the sign. Okay, so I'm trying to see if people that have raised hands. Jenny Mwika, yes?
So you talked about, on the clinical features, you talked about labile hypertension. What is labile hypertension?
On the clinical features, I talked about
labile hypertension.
Let me go. All right, were you able to follow slide by slide? Because I'm not getting the first page you're seeing.
Yes, like you talked about labile hypertension and cutaneous vasoconstriction.
We may have vasoconstriction that may affect blood pressure. That is the way maybe I will answer your question. May have that is vasoconstriction.
What?
You may have blood vasoconstriction that may affect you blood.
Okay.
Yes, because I talked about autonomic effects occur, which include tachycardia, arrhythmias, and labile hypertension and cutaneous vasoconstriction. So
yes.
Yes. So that is the slide. That is slide number 19.
Okay.
Yes, there was another hand up. Sorry, search for the other hand. So those that raise their hands, you can ask. Those that raise their hand, you can ask a question. Okay, so I should say there are no questions. You are able to follow. Have you found the platform favorable?
No.
Is the platform favorable so that we can use it?
Yes, sir, but you should send the notes also.
Yes, Daliso.
Hello.
Yes, Daliso. Yes, Daliso. Have you found the platform favorable? Okay, so if you have found the platform favorable, okay, so we'll be using it. I'm happy. It has been good attendance. I don't know about those that failed to log in. What the problem could have been. Okay. So I thank you most sincerely for attending. God bless you. Remember to stay at home and wash hands.